There are so many areas of healthcare that we talk about on the Wealthy podcast that are, well, all of them are important. But today's topic, I think, can be one of the most life-changing, and that is dental and oral health. Our smiles are the windows to our hearts and our souls, and giving somebody their smile back can be truly revolutionary. So today you're going to hear all about it from Dr. Michael Webster, who is the owner of Kelowna Dental Center and a specialist in dental implants. This conversation is actually fascinating. Please keep listening and learn how your dental health, your oral health, and the options that are available as we age can really change your life. So today on the Wealthy Podcast, we're exploring a topic that quietly influences not just our smiles, but our hearts, brains, families, and even our confidence and mental well-being. While most of us know that oral hygiene is important, we might not realize that neglecting our teeth and gums can significantly raise our risk for heart disease, cognitive decline, and other chronic illnesses. And it's not just adults, it's our kids and our parents. Dental health matters more than we think. I'm joined today by Dr. Michael Webster, a respected dentist and dental implant specialist here in Kelowna. He's going to share some surprising insights on how oral health impacts every stage of life, from why our kids sometimes get more cavities than others, to the unexpected dental challenges women like me face during perimenopause. We'll also tackle dental implants. Are they just cosmetic, or can they profoundly enhance quality of life and overall health? So that's my big, long-winded intro. Let's get at it. Welcome, Dr. Webster.
Thank you very much.
I'm so happy you're here, and I can call you Mike. Is that
of course.
Okay?
Yep.
Okay, amazing. So Mike and I have had the opportunity to chat a little bit while not recording. He's a really dynamic and colorful character. I can't wait to get into this with you. I would like to know, we have a bit of an opening tradition on the podcast. I would like to know what drove you to dentistry. Where in your life were you inspired? Like, when you say, you think of the things like, what are those jobs that like you could just never do? Like dentistry is one of those jobs for me. Where was your early experience in health or healthcare or dental, any of that? What inspired you to?
So, I mean, how honest do you want me to be?
Honest. Yeah.
Okay. So what inspired me was the money.
That's super honest.
To be completely honest. So, most people say that you'll hear a lot of dentists talk about that they, always wanted to be a dentist ever since they were a child. Though that wasn't necessarily the case for me. I wanted to, play in the NHL. I was born with these average set of genes, so unfortunately I wasn't tall enough or big enough. But I always enjoyed sciences throughout school. I loved that we could virtually figure out how anything occurs and happens through science. That naturally led to me taking biology and sciences in university. And at that point, my sister had just got into nursing. So then I started looking at different healthcare professions. To be completely honest, at first I wanted to do ophthalmology. I thought it would be amazing to do microsurgeries on the eye, and then I looked at the fact that you had to go to medical school and be like the top 1% to get into ophthalmology, and I just kind of wrote that off.
And you were like the only in the top 3%, because it's not easy to get into dentist school.
Well, no, it's not, and it wasn't definitely when I went through. There was a bit of luck involved with that, but. So then I literally remember I was on the web going through different jobs, and I found dentistry, and I'm not going to lie, I looked at what the income was, and I looked at the hours, and I thought, well, this could be a good lifestyle choice as well as a good career. Yeah. Looked into it more. What I found appealing about it was that we could help people on the spot and literally get immediate results for people. And the fact that I could still work with my hands was very appealing as well. in order to get into dental school, we actually had to, one element of the test to apply was a soap carving.
Oh,
So
no
I spent
way.
hours and hours and hours practicing carving a bar of soap, not your traditional bar of soap, but a cylinder of soap into exact millimeters and dimensions. And that's
What did you make? Like a swan or something?
no, not at all, not at all. Just different angles and
Okay.
and shapes, and then that was part of the test. We actually had to do it during the testing process, and then they measured it for accuracy, and we'd get a mark for it. So. Yeah, and then there's a lot of visual spatial components involved, and I just thought it was all very fascinating.
That's a brilliant test because like not
Yeah.
only do you have to like do that, but you have to do that like under stressful conditions,
Absolutely.
which is very
very stressful.
similar to probably what you're doing.
Yeah. Yeah, there's definitely an element of daily stress with dentistry, and
Yeah.
but it's also what makes it challenging and rewarding at the same time. So
Amazing.
yeah, then I was off to UBC, and interestingly enough, I didn't know if I loved dentistry all throughout it. It was very, I don't know, I just didn't find dental school to be all that practical.
Mm-hmm.
And then once I got out into the real world of dentistry, I was fortunate to have a couple mentors that really opened my eyes to what could be done with dentistry. So,
Amazing.
yeah.
And I'm going to just actually like ask you about that because I think, we've been having this conversation just within our office, some of my professional peers about mentorship. What was it that those mentors kind of brought to you that lit up that, because I mean, you chose dentistry for very practical reasons. And I don't think you should need to apologize for that either. Like we have to, I've been really thinking about how this idea that we follow our passion is sometimes kind of a little bit BS. Like we follow what we're good at.
Mm-hmm.
And then when we become skilled at it, that's where the passion comes from, right? I mean,
Yeah.
obviously, you're not going to become passionate about something you totally hate, but what was it about that mentoring that really lit you up?
Well, dental school, you were the quintessential professional.
Right.
Okay. And that's just not my style. I mean, I like to be myself and have honest interactions with the person sitting across from me. And that's not necessarily how dentistry was presented. It was a stereotypical white collared professional.
Right.
And then out of dental school, I went up to Fort St. John to get a bigger volume of experience in a shorter amount of time. Up there, you're very appreciated, and yeah, they don't want that white collared individual walking in. They just want
A real person.
a real person, and I very much enjoyed my time up there. And then I was through another mentor up there. I was introduced to a huge influencer in the world of dental implants, which is Carl Misch. He's considered the modern day godfather of implant dentistry, and he's world famous. He passed away about 4 years ago from a brain tumor, but I went down and took his course in Orange County, and this guy doesn't hold back. He says what he wants, when he wants, and he offends a lot of people, and he doesn't care, but ultimately he is there for his patients, and he gets incredible results, and his patients respect him, and he respects his patients. But he's just himself.
Right.
And I just sat in awe going, oh, you can actually be like this in this profession. This is fascinating.
Yeah. Yeah.
So yeah, that's where, and it's funny you talk about passion, because at Kelowna Dental Center, we had passion as a core value, and I actually took it out because I said, you don't have to have passion to do this job. You can come to work and be good at it and just do your job, but that doesn't necessarily mean you have to be passionate at it.
Right. What's more important?
Oh, I mean, it's a hell of a lot easier if you're passionate about it to do your job. So, but I wasn't to start.
Yeah.
And you're right. I had to get confident in my skill set, confident in my skin as a dentist. And even then, I wasn't quite passionate. I found something that I really loved, which is dental implants and implant surgery.
And got good
and
at
now,
it.
Yeah. And now I've become incredibly passionate about it and incredibly competitive about it as well.
That's awesome. I love that. Dentistry. Who knew?
Yes.
Who knew? That's a great jumping off point.
Yeah, so no dentists in my family. I was raised very blue collar. I'm a proud graduate of Rutland Senior Secondary. I make everyone know that. Yeah, so
love it.
Yeah,
were they the what? Oh wait,
we were the Voodoos, but we're not allowed to say that anymore.
Yeah, we're changed now. What is it now?
I actually don't know.
Okay, my son was an owl. I grew up in Langley, so we don't talk about that. But I grew up. My son was an owl, so there was a little bit of a. You want to talk about competitive?
Yeah.
So we've set the stage now.
Excellent.
I would love for you to kind of like start at the beginning. Like, I've had the opportunity to speak with sort of like the gamut of healthcare professionals on this podcast. Everything from neuro to bone and joint health to cardiac, like all of it. Dental health. Why is it so important?
Well, I mean, we've got that reputation of not being real doctors, right? Which is comical because the mouth is actually the gateway to the rest of the body. Systemic illness can originate from the mouth, can be exacerbated by the mouth, and often signs of systemic illness first appear in the mouth.
Mm-hmm.
I think everyone accepts very easily that nutrition is essential to health. So just on a very fundamental level, if we can't chew and process our food properly, it's going to affect our overall well-being. And we see this with denture wearers. We see a significant reduction in the ability to achieve or to obtain nutrition.
Right.
And we see decline in health with denture wearers because of this.
Because they can't
chew properly.
Yes.
Yep. Now, what we're seeing with the mouth is bacteria that can easily get into the bloodstream and affect every other system in the body. So, we've all heard of evil gingivitis and 1 and 2 having it. So even, you're at home, you brush your teeth, you floss, you get a little bit of blood on your floss. Well, essentially what we've done is we've opened a direct pathway into the bloodstream of our body. And the mouth has hundreds of thousands, if not millions of bacteria in it that can then go directly into the bloodstream and affect things like our cardiovascular system.
Yes. Yeah. And I was like so conscious of brushing my teeth and flossing last night and this morning. I think I have okay gums, but you don't have to look. Don't diagnose me right now. We
know when you brushed and flossed just the night before.
Shoot. I don't think I'm alone. I think a lot of us do that sort of like pre-prep. I'm going to the dentist tomorrow. I think I'll brush my teeth and floss for the first time since the last time we went. Okay, so many of us grew up thinking that dental health was mostly about cavities and cleaning, but as you've just said, how it's very deeply connected to our overall health. And I read somewhere that gum disease can increase the risk of heart disease by as much as 20%. Are you able to help us sort of understand how this happens? Is that a function of that bacteria, or is it the inflammation? What is the how does that work?
You said it perfectly there. It is a combination of both. Everyone's, inflammation in the body has gotten so much attention lately. We always hear about it, foods that cause inflammation, this and that causes inflammation, different ways to reduce this inflammation. But essentially, it is the bacteria in the mouth that, if it is allowed to get into the bloodstream through uncontrolled dental disease, such as gum disease or periodontitis, which is gum disease that then extends to the bone around the teeth, if that bacteria can get into the bloodstream, it automatically causes an inflammatory reaction throughout areas of the body. It can accumulate on heart valves. It can cause plaques to form in blood vessels, causing atherosclerosis. And yeah, just as you said, there's a significant amount of literature that shows that gum disease is linked to coronary artery disease, heart attack, and stroke. So this is more than just about having a nice, healthy smile.
Yeah.
This is about having a healthy life.
Yeah. And this is like one of those things we really try to talk a lot on the Wealthy podcast about prevention, like health prevention and promotion. So this is one of those things that is almost, I don't want to simplify it, but like it's as easy as having that good dental care routine, right?
Honestly, it is. Obviously, like most illnesses, they're multifactorial. There's other things
Of
at
course.
play, but there is nothing better than we can do than what we've been preached to from a young age, and that's brushing twice a day and flossing once or twice a day and doing everything that we know.
Yes.
The problem is sticking to that. Life gets busy. Falling asleep on the couch, watching a movie, things like that get in the way.
Yeah.
And especially the Western sugary diet. That's a big contributor to dental disease.
I will never forget. I don't even know who it was that told me this, but it has stuck in my brain, and I hopefully have drilled it into my children's brains, that there's bugs in sugar and they stick on your teeth. And if you go to bed with those bugs on your teeth, there's like bugs in your mouth like all night. And there's something about that I just don't want.
Yeah.
And so it really, like, it is, I don't even remember the last, this is me trying to like get brownie points with the dentist, but I don't remember the last time that I didn't brush my teeth before going to bed. And also when you get up in the morning, you just want to do that because like, ew.
Well,
right?
good for you, because I forgot last night while I was putting my 5 kids to bed.
Well,
so.
yeah. I mean,
Just
yeah,
kidding. Just kidding.
like,
My wife does that.
But you're not kidding about the 5 kids, which is crazy.
No.
Another topic for another podcast, but wow, amazing. So there's other links, important links between dental or oral health and our overall health. What are they?
The most common ones that we see. So if we want to talk about systemic illness, we already talked about cardiovascular. We're seeing links to cognitive decline, dementia, Alzheimer's.
Yeah, I just was reading a study about that.
Yeah, it's got a lot of attention in the last 10 years. Yeah. We're seeing significant links with diabetes, kidney disease. We're seeing different inflammatory illnesses such as colitis that will show up in the mouth with ulcerations. Obviously, the one word we're all concerned about, cancer. I mean, oral cancer, I believe, is the 5th most prevalent cancer. And those are the physical illnesses that we deal with. But one thing that does not necessarily get a ton of attention is the psychological components that go along with it. The vast majority of people I see for implant dentistry are people that have had a real deterioration in their dental health. They can't smile in public. There's depression that goes along with it. Mental illness is significantly linked to oral health.
Right.
So we deal with that on a daily basis, and it really doesn't receive the attention that it should.
At all. Yeah.
So I do, it's not a joke. Sometimes I joke about it that often we are as much of a counselor as we are a dentist, because people bring their problems to us, and it's vastly interconnected with their oral health.
Yeah. And I am looking forward to talking to you more about the implants, because I know that's an area of specialty for you. And particularly sort of like, I was looking at the before and afters on your website, and it is like, wow, I can't even imagine what that must be like for a person who's living in a body with, having gone through life with us, with a smile that's been impacted by whatever, like so many things. And then, wow, your work is magical.
It's quite remarkable.
So if you're ever interested, like, in seeing just remarkable transformations, go check out Dr. Webster's website. It is like, wow.
Thank you. Yeah.
My heart was like, oh, it must have been so amazing.
That means a lot. It's it's a fun journey to be a part of with
I'm
these
sure.
individuals. It's quite incredible.
Yeah, I'm sure. Okay, but before we get there, I kind of want to just get to like basic standard of care. So we've talked about, okay, it's important to take care of your oral health, right? For a multitude of reasons, not the least of which is like more of these systemic illnesses, but also because it's really important to chew. It's really important, you want to have that bright, happy smile. What's basic standard of care?
Pretty straightforward. So let's start with what we can do at home. Twice a day, brushing for 2 minutes on average with a fluoridated toothpaste. Pretty much any over-the-counter fluoridated toothpaste would work. Flossing minimum once a day. If you can do it twice, that's wonderful. Yes. A big thing that most people can improve is having some attention and focus on their diet.
Okay.
So the bacteria in our mouth that cause cavities, they feed off simple carbohydrates. So obviously the most clear example is sugar, but it can be any type of simple carbohydrate in pasta, for example.
Mm-hmm.
If we eat a high enough frequency of simple carbohydrate containing foods, it allows the bacteria to grow to high enough levels that they produce enough acid that starts causing cavities. Okay, so an example that I give a lot of patients is, hey, if you have a sweet tooth, great. Eat it at one sitting in the day. Have a bucket of candy, go ahead. Maybe not that much. But if you don't touch it again, you'll actually be okay. But if you're a snacker and you're constantly giving the bacteria in your mouth a supply of simple carbohydrates every couple of hours, those are the individuals that start to develop cavities.
They're the bugs, or you're feeding the bugs.
Yes, they're real.
Oh gosh.
Sugar bugs.
Yeah. Okay.
Yeah. So focus on the diet, minimize that intake of simple carbohydrates. Examples of professions where we see higher incidences of tooth decay would be truck drivers. They are notorious for sipping on coffee with sugar or soda drinks while they drive.
Or like just having a candy.
Yeah,
I do that to stay awake.
100%.
Yeah.
Chefs and cooks tasting food all the time. Rampant decay in these individuals. So if we can get that under control with our basic hygiene at home, we're already ahead of the game. Now, the next step to that is obviously seeing a dentist. And why that's important is, that saying, if it ain't broke, don't fix it. Well, that doesn't work in dentistry.
Mm-hmm.
Dentistry and dental illness is very similar to, heart attack, the silent killer. 90% of dental conditions are asymptomatic. We don't know they're there until it's gone too far.
Right.
Pain is a protective mechanism by the body, but when we feel pain in the mouth, essentially it's telling us it's too late.
Oh, wow.
Now it's not too late, but now we likely have to intervene with a more involved sort of treatment.
Right.
It's not just prevention and maintenance. Now we're into, say, fillings, crowns, extractions, root canals, whatsoever. We're trying to minimize the damage that's occurred in the mouth.
Right.
So if you are symptom-free, that doesn't mean that something isn't going on. That's why we need to see a dentist in order to take correct diagnostics to see if we have any concerns.
Right. So, and that's twice a year.
That's what we recommend. It can vary depending on susceptibilities, depending on disease status of the individual. For example, we have someone that comes in for their first dental visit. They haven't been in a few years. Often there's a significant amount of buildup that needs to be removed from the teeth. So we may see that person every 3 to 4 months for the first year,
right,
in order to get things under control. Now let's throw in they're also a smoker. Well, now they're even more susceptible. So that person may be on a 3 to 4 month maintenance schedule indefinitely.
Wow.
Yeah, it really depends. So when we say every 6 months, that's your typical person who doesn't have a lot going on.
It's like a maintenance program.
Yeah, exactly. But we will tailor that to the individual.
Okay. Now I'm going to ask you, is there about kids? You've got 5 of them and you're a dentist. So I feel like you're an expert in this area. there's been a real, I know, you shouldn't have told me that. Now I just like the next level.
Well, the funny thing is that I have 5 kids, but I do not see kids in dentistry.
Oh, you don't?
Well, I used to. So
I feel like that's actually, I love that you say that, because I feel like this is why I'm asking you, because I feel like for kids, it's a bit of a different story.
it is.
Right?
Yep.
They have different anxieties. They have different like things that are happening. I was going to ask you about juice, like, is that, I know for adults, especially if you're sort of paying attention in kind of like these health conversations right now, juice is like public enemy number 1.
Yeah.
Is it like same?
Yeah. I mean, it's full of sugar.
Yeah.
So yeah. Now,
But like we used to give okay, I never did, but like it was a thing to give our kids like a sippy cup of juice.
Mm-hmm. Yeah.
As a dentist, would you say, what would you?
Well, the problem with that is like I said, the frequency.
Right. Okay. So 1 cup of juice, maybe.
Yeah. There's no harm in that. Just like having a certain amount of sugar throughout the day is not necessarily the worst thing. Everything in moderation.
Right.
Right. So, I have 5 very active kids. So am I going to cut them off from all the simple carbohydrates when they need that fuel for their activities? No, not necessarily. Am I going to try to monitor and limit it slightly? Yeah. But it's a challenge.
Yeah.
It's a challenge with kids, and it's you said it, it's a different ball game with kids. We're trying to promote healthy habits right from an early age. The healthy habits really originate with the parents.
Right.
And this is fundamental literally for their whole dental health as a child into their teenage years and even into their adulthood. We see certain habits form. I mean, everyone knows about dental anxiety. The amount of stories that we get on a daily basis of the baby boomer crowd, of the butcher dentist down the road who didn't freeze them, didn't listen to them, pulled the teeth. Right. Well, it's astronomical. So dentistry has come a long way in that sense. But let's be honest, it's still a scary place.
Yeah.
Kids know that they might be getting a needle.
Mm-hmm.
We know that there might be things going into their mouth that look scary.
Yeah, or uncomfortable.
Yeah, and no matter what, right? Even doing a filling, technically, and the public doesn't always look at it this way, it's a surgery.
Yeah. Yeah.
It's a surgery. We are cutting into a substance in the body in order to repair it. So it
drilling.
Yeah, and the sounds, the smell, and I mean that just initiates a lot of anxiety in a lot of individuals.
Kids and adults.
Yes.
Yeah.
So it's not uncommon. We will see new. When I did see kids, my office still sees a tremendous amount of kids. I have a couple associates that are just fantastic with kids, so they see all the kids. But we will see parents bring in their child for the first visit, and we will see this extremely anxious parent.
Yeah.
And we're just watching it radiate down to that child.
Yeah.
And then we'll often hear about how anxious the child is with their visit, and really we'll see the child and they're not anxious. Mm-hmm. It's completely the parent. Mm-hmm. So we try to have soft conversations around that. Like, listen, we don't want you to lie to your child. Like, we don't want to not say they're going to get a needle. We want to address those things, but we also want them to know that it's not necessarily completely scary.
Yeah.
That we have to do it, and that there's positives to it.
Yeah.
And to try not to pass on that anxiety.
Yeah. More is caught than taught. Right?
Yeah, absolutely. So,
and this is no judgment to parents out there. It is hard. And like I being a parent myself, some kids are just more sensitive than others, right? Like their ability to pick up on your own anxiety. Some kids are naturally better at it than others.
And you're right. It's not a knock on parents. My kids, being a dentist, my 10-year-old, she's had about 20 cavities. So like it happens, right? Yeah. And then I just look at my second and I say, don't try to lie to them about getting a needle. Well, my second, we literally would have to pin her down to get her vaccinations.
Oh,
and
yeah. Yeah.
So yeah, I've been through it all, and I understand it's a challenge, but
Yeah. We as parents, I think, I mean, I know for me, there's certain things that dentistry is not one of them for me. So my kids, I don't even know if that's as a result. They never really had any anxiety around that, but I have anxiety around other things. And as a result, my daughter, who's the more sensitive one, has the same anxieties. No shocker there. I'm actually going to ask you about, you mentioned that your daughter, your oldest child, has lots of cavities. I have 2 kids. My son, oh my gosh, my poor children. My son has had, let's call it questionable oral hygiene practices over the years. Sometimes it happens, sometimes it doesn't. I take him to the dentist. They're like, well done, buddy. Good job. Looks great. No problems. Way you go. My daughter, who is also a Virgo, pays very good attention, likes things to be clean, brushes her teeth, does the flossing, asks me about rinses, like all of these things. We go to the dentist and they're like, oh, Jade, we got a couple of spots we need to watch. And then there's this, and then we got to do a filling over here. Why?
Yeah, this is a common example we see, and a very common question from parents.
Yeah.
There are a couple very famous studies that they did on twins. Same diet, same home care, same dentist, same everything. One would get dental disease, the other wouldn't. And what the conclusion basically was differences in genetic susceptibility.
Okay.
So right down even amongst twins.
Interesting.
And we see it all the time. And sometimes they'll bring their one kid in and they go, little Johnny here never brushes or flosses, and he does not have a single cavity whatsoever. Yeah. And then and it's funny because my 10-year-old, she's our best brusher, but she's getting cavities all the time. Now, even on the individual tooth level, we can just look at, say, the depth of the grooves in the teeth can be a contributing factor. If you have deep grooves, no toothbrush out there is getting at them. Yeah. It will collect the bacteria and eventually can lead to a cavity. So there's things like that as well.
Right. Well, so can I say that, like, my son got his good teeth from me?
Yeah, you can
my
do a degree.
Got them from
take the credit. Absolutely.
Yeah, I'm going to. So I'm going to sort of switch gears a little bit here. I love that you're sort of able to paint us this picture of overall dental health throughout our lifespan, because it does change, obviously. So many of my friends are in their early 40s, 50s, are starting to know, my friends, like women, noticing some changes, like, okay, tooth sensitivity, like I'm like a Sensodyne gal, like I hope that's okay. Bleeding gum, okay. Oh my gosh, I just actually want to ask him like all my problems. Like I get canker sores, like blah, blah, blah. Anyway, I'm not going to. I'm going to hold back. But like all these changes that happen, I'm assuming because of hormonal shifts. Is this common? Like, is this a thing? Are we recognizing this? And are there things that we can do to help mitigate that?
Yeah, it's true to a certain degree. And I mean, we can just look at pregnancy as an example.
Yeah.
And pregnancy gingivitis. Like, you cannot deny that. There's change in hormones, change in estrogen receptors in the mouth that results in susceptibilities to gum disease.
And like normally healthy women who've never experienced gingivitis will all of a sudden in pregnancy have gum disease.
Absolutely.
Yeah.
And then there's definitely an increase in susceptibility to tooth decay. I'm not sure if that's just because there's a tendency to binge eat during pregnancy.
No.
Just kidding. I made that up.
No. Goodness.
No, but there is a little bit of that, right? There's different things that become more different tendencies, right? Different cravings. That's the word I was looking for. Now, with respect to, so that's the element. There is a systemic change in the mouth as a result of the hormone changes that are going on. But then there is also what we see the unique thing about teeth is they're one of the only substances, if not the only one, in the body that cannot repair itself. Okay, so when we lose enamel, the outside protective layer on our tooth, it is gone for good.
Right.
Unless we intervene with what we call restorative dentistry, and that's replacing that enamel with a filling or a crown.
Right.
So what we typically see as we age is not always a result of changes in hormones, but it's a result of cumulative damage or wear and tear on teeth. So, for example, sensitivity. Sensitivity will occur as our enamel thins over time. Well, it's going to thin over time just through regular eating.
Right.
It's going to thin over time from brushing. It's going to thin over time based on the type of toothpaste you're using, based on whitening toothpastes, if you're whitening in general.
Right.
Things like that. And then also same with the bone levels around our teeth. Those do not return. If we lose that level of bone due to gum disease, which extends to the bone being periodontal disease, we end up with gum recession. Well, gum recession exposes the root of the tooth, which is extremely sensitive as well. Mm-hmm. So as we get older, it's, unfortunately, those things are adding up. Those factors are adding up, and then we start to experience more dental symptoms.
Mm-hmm. Interesting. You've mentioned the gum receding. It's not on my list, and I almost feel like there's another episode in here because there's so many things that we could discuss. But I've known a couple of people that have had to go through that whole process of gum grafts and it is not good time.
Yeah, it is considered to be the most painful dental surgery.
Yes.
The gold standard is taking a piece of tissue from the roof of the mouth and attaching it basically to where we want to regain the gums.
Right.
The roof of the mouth is ridiculously sensitive. And
Okay.
You just imagine, I think everyone out there has had like a pizza burn or something like that.
Yeah.
Well, you get that type of pain ongoing for about a week. So yeah, it can be quite uncomfortable.
And is there any way to mitigate that, or is it just sort of a process of aging?
There is. Are you saying the gum recession? Yeah, without a doubt. There's definitely people in their 80s that don't have gum recession.
Yeah.
It's back to those fundamentals though.
Right.
It's minimizing that bacteria in your mouth so that you're not getting bone loss. That's that brushing, flossing, proper brushing technique. A lot of harm can be done by the way we brush. So those big broad strokes using force. Yeah. No scrubbing. Scrubbing's not good.
Right.
Exactly.
Circles.
So ideally when you brush, you should be able to gently flick the toothbrush out of your hand. That's how gentle it should be. And it should be an up and down motion. It shouldn't be a cross motion. So there's simple things like that will absolutely minimize our risk for gum recession.
All right. Well, okay. I will start to do that when I get home today. I'll try. It's just so satisfying.
I know. It's counterintuitive to what we're used to, right?
Okay, I want to move into an area that you've already sort of mentioned, dental implants. It's an area of specialty for you. And I think it's an area of mystery for a lot of people. Most people are just sort of assuming that it's cosmetic. Like there's all this stuff flying around the internet right now about Miley Cyrus. Did you see that stuff?
No.
Oh, I think she might have got some, right? Yeah, Arden's nodding. And there might... Anyway, a lot of people have a lot of opinions on it. But my point is that I think generally when we think of dental implants, we just think about like the cosmetic, reasons to get them. But there's all sorts of other reasons. And like you said earlier, pretty life-changing for people on many, many levels. So what are the primary health benefits? Like you've sort of outlined it a little bit, health benefits, and like why are these an option for people?
Sure. First off, dental implants are not cosmetic. We do them for functional purposes. We do them to restore someone's oral health. They can be absolutely beautiful though. at the same time and achieve a
Why not?
cosmetic result.
Yeah.
Absolutely. And that's the beautiful thing of dentistry and advances in technology and materials that we have, is that we can drastically improve someone's smile. But the main reason to do a dental implant is when someone has had a dental illness such as cavity or gum disease, periodontal disease, that has become so significant that we've lost a tooth. That's the primary reason. Losing a tooth will, everything in the mouth technically is in perfect harmony. Okay, as soon as you take a tooth out, you now will gradually start getting drifting and spacing of teeth over time. That spacing results in accumulation of food between the teeth, therefore an increase in bacteria and an increased risk for dental disease. So the sooner we can get a tooth replacement in there, the less shifting we have. We want to prevent that shifting immediately. It's also, every tooth takes a certain amount of force in the mouth when we chew. So you eliminate that tooth, and let's say it's a big back molar that does all the chewing. That force has to go somewhere. So now the adjacent teeth are taking more force, and they're more susceptible to cracking, and we see that as well. So it's an easy fix when we get on it right off the bat and get a tooth replacement in there. But the longer we wait, we tend to see an increased risk of tooth loss and associated dental disease with it.
Right, which makes sense.
Yeah.
What about people that have lost, like you said, you play hockey?
Yeah.
Like we see that, I remember being a kid and a friend of mine fell down a slide. He lost his two front teeth. Same? Like,
yep.
Yeah. So same idea. Is that?
Yeah, 100%. I had the same. I don't have dental actually. That's not true. I got my first dental implant over Christmas.
Oh,
yeah. Like, it always happens.
Which one?
Over Christmas. My second back molar on the bottom.
Oh darn! You can't
it cracked.
Show me.
No, I can't. Well, it cracked, and you know what? It was an outrageous amount of pain, and I had to get into the office over Christmas, funny, and get my associate to do an implant, but.
Always happens over Christmas or a long weekend.
Yeah. So front teeth, we often look at those as cosmetic teeth. I mean, they are. That's a social thing. In our society, we view people with healthy front teeth as better looking and potentially more successful.
That's actually a thing. Like there's research on it.
100%. But from a dental function perspective, there are tearing teeth. So we use them, it's kind of obvious, to tear through food and then push it back to the mouth, to the back molars, which we then chew the food.
Yeah.
Okay, so it's all a harmonious system that works together.
Right. So you need all of them.
Yes, you do.
Yeah.
So dental implants for missing front teeth, fantastic for function and great for cosmetic as well.
And I don't have a hockey player in my house or somebody that's lost a front tooth, but would you recommend those be replaced immediately, or do you wait it out?
You can wait. Well, it depends on age.
Okay.
So we definitely want, we don't want to do dental implants in teenagers and even some young adults. We want to make sure that they've gone through completed their growing. If you place dental implants too soon and the mouth and face continues to grow around them, that dental implant will stay in the same spot, but everything else will grow. So we do not do that. And actually, there's more and more research coming out that is kind of recommending that below the age of 40, we probably shouldn't be placing a dental implant in a cosmetic area.
Interesting. Okay.
So this is not common. This is not common knowledge amongst dentists. We are all placing dental implants, in 20-year-olds, 30-year-olds in cosmetic areas. But the problem is, and it's very hard to predict, in the wrong person at the age of 50, 60, due to the continued regrowth of the bone cells in the jaw, that dental implant will stay where it is and the rest of the teeth will shift down, and we'll have a big problem on our hands, not just cosmetically, but it'll also cause inflammation and potential infection of that implant as well. So yeah, we, as far as a young age, we want to wait.
Yeah.
As far as everyone else, the sooner we get a dental implant in there, the better. Like I said, the less shifting. If we wait too long, then the ideal way to treat the situation is to put someone through braces or clear aligners such as Invisalign to put the teeth back to the right spot in order to get the dental implant in.
Got it.
Another thing too is that as we wait, we continue to lose gum tissue and bone. So if you've ever seen, well, you have all your teeth, so I don't think you've experienced this.
That you know of.
Yes, exactly. But
I do.
We'll start to see the ridge that held the tooth originally shrink in size. If you're missing multiple teeth, then you can actually see on the external face changes in the shape of the face. So it can be quite significant.
Yeah. So the sweet spot then, I guess, in terms of the optimal patient for this, and I'm going to get into the differences between dental implants and sort of our traditional interventions like dentures in a minute, but I just want to clarify. So the sweet spot then for folks who are considering this would be what, like 50, 60?
Well, that's
or like whenever it is.
If I'm going to put an age on it, it's your most common dental implant patient is somewhere in the range of 55 to 65.
Okay.
And there's some economical factors to that.
Yeah. And we'll talk about that. Yeah.
There's also, we discussed it earlier about the cumulative effects of wear and tear on the teeth. Especially if we look at the baby boomer population, it was very prevalent to put in these massive metal fillings into people's teeth. So we didn't have as conservative measures or ways of treating dental disease. So we'd put these massive metal fillings in teeth that over time, getting pounded as they chew food, they slowly crack and break down.
Yeah.
Around 55, 65 is commonly when we'd see a lot of teeth start to split.
Right.
And then sure enough, you're in for a dental implant.
Right.
So lots changed in the field. We used to, you had an infected tooth or a broken tooth, you would take it out, let it heal, go back a few months later, place a dental implant. And still there are some dentists that do it this way, but the ideal time, what we do now is what's called an immediate placement implant. If we want the tooth still in there, the infected tooth still in there, take it out, put an implant in the same day.
Okay.
And in doing that, we essentially lose zero bone and zero gum tissue around it, and we can get you the most natural result.
Amazing.
Mm-hmm.
Okay, I am not yet at the age where I'm considering like dentures or implants yet, but like back in the day, like I just remember my father-in-law, bless him, he's passed now, Wayne, but he had like the full dentures.
Yep.
And one night, I love this story so much, and he was such a lovely human. But he had a couple too many glasses of wine, and he ended up like his dentures fell out, like, and like it was kind of a funny moment, but like. I'm sure that's quite a common, too many glasses of wine, but it's a common.
Well, I think both, but.
Okay. Yeah. But so what's the difference? What are we talking about here? What's the difference between dentures and like, do people like lose all their teeth? I just have so many questions.
Yeah, no, this is, if we're looking at the most impactful element that dental implants can have on someone's life, it would absolutely be denture wearers.
Yeah.
So denture wearers, there's multitudes of reasons why they can end up in a denture. It's not, we cannot just stereotype it as neglect. We can't, there's so many different factors. Now, whatever that is, let's use gum disease as an example. Uncontrolled gum disease leading to bone loss around teeth. Essentially, if it gets too extreme, we have to take the teeth out because the teeth become wiggly, non-functional.
Right.
And then there's all the other concerns we talked about, with nutrition, that bacteria going into the bloodstream. When we put someone in a denture, it's kind of a last-ditch resort. It is a future goal of mine that we will never put any individual into a denture. The only convenient thing, the only benefit to a denture is that you've got someone in teeth. You've given someone teeth.
Yeah.
But there's a significant reduction in the ability to chew food. it's about a 10% reduction in your chewing forces, or sorry, about a 90% reduction. You only retain about 10% of your function. So you avoid nutritious foods, which are often hard.
Like the crunchy stuff. Yeah.
So we see an overall decline in health. Now, underneath those dentures, even if we think they fit well, which some people they do, some people come in and say, I don't have any issues with that denture. What it's doing as we chew and function is it's sliding side to side. It's actually causing friction on the underlying bone, and it leads to faster resorption of that bone. So again, if it ain't broke, don't fix it is the wrong approach. When it starts falling out, that process usually started 10 to 20 years before from wearing the denture.
Right.
Now, when it's falling out, when you're functioning, it virtually means you have no bone left.
Right. There's nothing for it to like stick to.
Now, the beautiful thing is that even in individuals who have no bone, we have solutions for them. We can still get dental implants in, anchor a denture to, or anchor a full set of porcelain teeth to, restore your function almost 100%. And it's quite amazing. Give you back what you lost, basically.
Yeah. So, like, tell me about the process then. I mean, I love that you've outlined the differences and the benefits to this. It's definitely it's like a health choice. As you said, this is not about cosmetics. And this is why I was really happy to have you come and have this talk, because I do think so often we overlook dentistry in general, and certainly this aspect of it, because we just sort of write it off as cosmetic, but it's not. It's definitely directly linked to our overall health and longevity in some cases, right?
Yeah, it's an incredible journey. So primarily what I do is full mouth dental implants. So exactly what we discussed is there's two typical types of patients: those that are about to lose all their teeth and those that have lost their teeth. It is remarkable when we finish the dental implant process and they've got a new set of teeth in, and we do our follow-ups with these individuals, you can literally see their faces change with how healthy they become. It's a drastic change. I mean, I think you've seen some of the photos.
I have.
And
I just saw the photos. I haven't even talked to these people in real life.
But. Yeah, it's quite remarkable. And, my job too is to educate people that this is an option, because it's not very well known, to be honest.
Yeah.
And it's funny because on a lot of our advertisements, let's say on Facebook, we'll get comment after comment that they are not the same people.
Right.
And it's just because of the difference in their health and how they look. It's incredible. Many individuals take this opportunity to change their whole life. And that's not just their dental health, but the amount of people that I've had that undergo this and stop smoking.
Right. It's a catalyst.
Yeah, absolutely.
Yeah.
It's the, kind of the first step to them regaining a healthy life. So
you start to see yourself differently.
Yeah. Well, so it's funny because many of these patients come in, they all come in because they want to improve their health. They want to get their function back. Whether they admit it or not, they also want to have an amazing smile.
Yeah.
But what routinely comes up is lack of confidence, not going out for dinner, not dating, not applying for jobs, things like that. So when we can restore their dental health and provide them with a beautiful smile, they're back in the game, basically.
Yeah. That's amazing. Okay, I think I have to ask this question because I don't understand the process. And so when you talk about it in my head, the story is probably different than what happens in real life. Like, so I think a lot of people are scared that like you're literally drilling in, and like, tell me the process. Just demystify.
So absolutely. If we start with, a simple single dental implant, and in particular, the way I do it is the tooth comes out and the implant goes into the socket. It's actually quite uninvasive. It's because we already have a site there.
Yeah.
We're essentially, in layman's term, filling a hole. For a single dental implant, it's mild discomfort for a few days later, minimal swelling. Most people are absolutely amazed. They say, hey doc, I didn't feel a thing. And that was simple. Obviously, as we lose more teeth and we lose more bone, it becomes more of a challenge. So when we get into things like bone grafting and gum grafting, well, symptoms and healing duration definitely goes up.
Mm-hmm.
Okay, so sometimes we have to do a separate bone graft to gain enough bone to put dental implants in.
Right.
Well, that's going to delay the process. That's going to increase discomfort afterwards and morbidity. We provide excellent medications to reduce any discomfort. And for myself, how I practice is all my dental implants are done under conscious moderate IV sedation. Right. So you're as close to sleeping as you can be without being under general anesthesia in the hospital.
So like a colonoscopy.
Very similar. Okay. Yeah, everyone says that, and it's very similar. About 98% memory loss, so most people don't remember a thing after. It's a great way to do it. It gets rid of any of that anxiety, and I mean, I can't sugarcoat it. We are drilling in bone.
Right.
Okay. Now, if let's say you weren't IV sedated, you'd be numbed. You wouldn't feel pain. You would feel pressure and vibration in the sounds.
Right.
So that enough for most people is that, yeah, exactly.
Same reason why I want to be same condition for a colonoscopy.
Exactly.
Right.
So
some things you just don't really want to remember.
Yeah, no, everyone is quite happy with the IV sedation. Yeah. That's probably the fan favorite of the whole procedure. So
good drugs, eh?
Yeah, and then once the implant's in and healed, it's very easy to put a tooth on top of it. Everything's digital now. There's no additional procedures needed as far as freezing and surgery. We basically scan the implant, develop a crown, and it goes on top.
Wow.
Now,
the implant is like the
implant is the titanium fixture that goes into the jawbone. And then you
put the tooth on it.
Yeah, and essentially it has a screw access hole on the top that allows for us to put any sort of attachment on it, which is typically a porcelain crown.
And do you just go through the whole everything, like all the teeth, all at one time?
Depending on, like
so if it's just like uncomplicated case.
What 95% of what I do is what I've coined as new teeth today.
Oh.
So the individual, yes, I'm the
that's a good marketing.
It's incredible. Yeah. I'm the founder of it and CEO of New Teeth Today. Actually, I am trademarking it right now.
There you heard it, folks. Don't be stealing that.
Yeah. So it is this, I mean, I get goosebumps talking about it. This is what it's about for me. This is my passion. And being able to be involved in someone's transformation is absolutely incredible.
That's so immediate.
Yeah, it's crazy. So they come in. I mean, there's a lot of work that goes into it. We do a consultation. We do a records appointment. We go over the procedure in depth. But then we schedule the surgery, and in one single day, the patient will come in, or remove all the teeth. We'll install about 4 to 6 implants on the top, 4 to 6 implants on the bottom. We digitally scan all these. We digitally design them a new set of teeth, a new smile, using their photos, using 3D facial scans. We 3D print right in-house a new set of teeth that then are installed the same day. And when they wake up from their appointment, they're so cool. Yeah, they're handed a mirror, and we often are sharing a moment of just tears, and it is incredible.
Oh, yeah. That's amazing. I was going to ask you about that. Is that like the best part of your job?
It is. I mean, I'm a general dentist that only does now New Teeth Today.
Yeah.
I cannot go back to other forms of dentistry.
Yeah.
It's just it's incredible. To be part, it's an honor to be chosen by these individuals in order to provide them with this service. Mm-hmm. It's like none other in dentistry.
Mm. Yeah, I love that you've shared that there's like obviously you've done a really good job telling us about why this is something people should consider for sure. There's many, many health benefits. But as you mentioned, like the emotional or mental well-being, I mean, I get it. Like I listen to you tell this and I'm like, oh, that would just be the best. What's it like for people? Like, are they just truly so grateful and happy?
100%.
Yeah.
For years to come.
Mm-hmm.
Yeah, like it sounds kind of corny, but we definitely become like an extension of their family,
Right.
because
Yeah.
we've gone
It's a
through such an
huge thing.
incredible journey with them. We were just filming a commercial with an individual yesterday, and he was just he's got this incredible personality. We finished his teeth about 6 months ago, and he was just talking about how prior to doing it, he used to hide in the back corners at social events. And now he says he just like he's the first person, and he's like I always wanted to be the center of attention, and now I get to be it.
Oh, amazing.
And these are not unique stories. Like we do about 20 to 30 of these surgeries in a month, and almost all of them have a similar story. A recent one was this is a bit of a tearjerker, is that she came back and she said that her kid said, "Hey mom, we got our mom back."
Oh.
And that's pretty impactful.
Yeah.
So,
yeah.
I'm
Life
very fortunate
changing
to be a part of this journey with these patients, and yeah, like I said, it's absolutely remarkable.
Well, and they're lucky to have you because this is, like you said, it's a huge life-changing experience, and to be able to walk alongside somebody who is so relatable and so open and willing to sort of tell it like it is, and I think you really break down barriers. Certainly I can feel that from you. I have to ask, Jason is like giving me the wrap signal already. You were so worried we weren't even going to have enough to talk about for an hour. I know, right? Like, but I have to ask you, because this is like the elephant in the room. This is not covered by extended dental plans. This is, a fee-based, and we don't typically do that. Like on what, like we talk about, but this isn't about promoting a business. This is about promoting sort of a health service. I mean, it is.
I'm just kidding.
I know, but I love
no,
that
it is. It's not about promoting a business for
but
me.
How do you deal with that? Like, how can people, because it's not cheap.
No.
And like, are there options for people that really want to do this, that are listening right now and they're like, yes, I'm in. How do I make this work?
This is by far probably the most important question and the biggest challenge we face. So there is that idea that dental implants are cosmetic, and where I truly believe that originated from is from insurance companies. So most insurance providers or benefit providers do not cover dental implants, and they actually refer to them as a cosmetic procedure, and that is simply inaccurate. Benefits are a benefit, but they're not there to fully support our dental health.
We have to,
and this is our situation in Canada. Whether that changes in the future, I mean, we are seeing changes already. I don't know where dental implants will fall along that line. I would love to see coverage for them. Unfortunately, we don't have that right now, and it's a bit out of our hands. Interesting that you asked me that, because I actually am a co-owner of a dental finance company that allows us to finance to patients in order to have monthly payments to get dental implants.
Right.
So I always hear, well, this is for the wealthy. Well, it's a lot of money, yes, because of the training that it takes to provide this service. It's been a 15-year journey for me to be able to provide new teeth today and get predictable results on every single surgery. The tech that's involved is changing daily. Mm-hmm. So we're updating tech all the time. My team that I use to provide new teeth today is a team of 12 individuals. So start to finish, there are 12 people that are working on the case for that patient. A lot is not seen, it's behind the scenes, but it's a costly procedure. It absolutely is. We can finance this and break it down into monthly payments and allow for, the blue collar individual to get this done. It is incorrect to say that this is only for the rich, because I actually don't think I've done this on anyone that is truly rich. Most people is just, average Joe or Jane who want to get their dental health back. So beyond financing, that's our best option right now. We do see some insurance coverage on it. But you're right, it is definitely a barrier to getting this treatment done.
Well, and I think maybe the message is too that, if somebody listening is really considering this and wants to discuss it more, they can come and see you.
Absolutely.
And, you work with those. That's the nice thing I get from you, is that you work with people. It's not just sort of one size fits all.
We do everything we can in order to have people get this treatment.
Yeah, that's amazing.
Yeah.
So funny. Hey, it's such a rich topic. And again, we don't talk about it enough, but there's so much to talk about.
Yeah.
I want to just switch gears very quickly, because I think this last little piece is important. How has your definition of health and healthcare changed over the last, couple of decades since you've been actually working in the field?
Oh, that's a big question.
I know it is.
That's a massive question.
Wrap it up in a TikTok clip.
Well, it's always evolving. From dental school, it's completely different.
Yeah.
So I think healthcare nowadays is more individualized, and it's more about learning about the patient or the person sitting across from you and what their desired expectations and results are. Because there's no two individuals that are the same. Everything has to be tailored to that individual. And we're in the era of, knowledge is power. So a lot of people are coming in with preconceived ideas, which a lot of times are excellent, great knowledge, but a lot of things that have to be debunked as well. So being able to relate to that individual is absolutely crucial to having, successful treatment for them.
And maybe that's why you didn't fall in love with dentistry until after you were out of school, because I sense that you're a pretty like relationship and connection is important.
Yeah, you have to be. Trust is everything, especially for these full mouth procedures. If they don't, because sometimes curveballs happen. Sometimes the path isn't directly straight to get to the end. And as long as the individual knows that I'm doing everything I can on my side, we'll get the result. Trust is absolutely crucial.
I love that. Okay. So this podcast, as you know, is called Wealthy. And the underlying sentiment is that health is wealth. And so, and that there are many different facets. We've talked about one today, but there are many that make up our overall health. What areas of your life do you feel that you are wealthy or abundant?
I mean, I am extremely wealthy in my life. And what I would say is that, I've got an awesome balance. I'm passionate about my profession, which is, I'm incredibly fortunate to be passionate about it. Not everyone can say that. And then I get to go home to 5 kids and an incredible wife that keep me healthy and keep me motivated to stay healthy out of work as well. So it's been a long road to get to this point. 5-10 years ago, I was completely different. Many internal struggles myself, was not healthy whatsoever. So, yeah, you're absolutely right. I love the name of the podcast because it couldn't be more accurate. And I like to think of myself as a pretty healthy individual with a lot of life left to live and a lot of helping still to provide to people.
Amazing. Thank you so much. I didn't, as usual, didn't get to a lot of my questions, but I think you did a really good job making an area of healthcare that typically people want to turn away from interesting, and giving us a reason to pay attention. You're a character. I've really enjoyed this conversation. Thank you so much. Is there anything else that you want to, before we sort of close off, that you want to leave our listeners with?
I mean, honestly, it would be to every single person out there is just take that first step. Doesn't matter where we're at with our dental health. It matters where we can get to. So take that first step, pick up the phone. Don't be ashamed if things have been left too long. We're here to help, and we're definitely not here to judge. So
yeah, I love, there's a quote. I don't even know where it came from, but I often think of it when things seem like there's these big mountains in front of you, and like, where do you start? And the quote is, the key to getting ahead is getting started.
Absolutely.
Well, yeah. We'll just leave it at that. Thank you.
Thanks for having me.
This has been a great conversation.
Absolutely.